Welcome to a glimpse into the multidisciplinary approach to cancer management interview. My name is Vicky and I am the Professional Relations Director for this year. Before we begin with the interview, I would like to thank all of our professionals for taking the time out of their busy schedules to sit down and share their insights and experiences with our audience. Now, could you first please take turns introducing yourself to everyone watching?
Sure, I'll start. My name is Shantanu Banerji. I'm a medical oncologist working at CancerCare in Manitoba, and I'm a scientist at the Research Institute there as well.
Hi, I'm Sapna Brai. I'm one of the pediatric oncologists at CancerCare, and I'm also an affiliate scientist with CancerCare Research Institute. Thank you.
Hello, I'm Rick Bhullar. I'm one of the MSK radiologists at the Health Center and part of the sarcoma group as well.
Okay, my name's Dr. Pamela Hebbard, and I am a surgeon. My formal title is that I'm a surgical oncologist, and that is a general surgeon who's done extra specialized training in cancer surgery.
Thank you so much. So before we begin, I'd like to just introduce Project Pulse Winnipeg. Project Pulse Winnipeg is a branch of the nationwide youth-led initiative, and we strive to familiarize high school students with the world of health sciences. So we are a nonprofit organization, and we are composed of both high school and early post-secondary students. And through our conferences and online platforms, we connect students with professionals, university students, and other individuals just like yourself. Now, do you have any questions just about us and what we do? Okay, great. Well, without further ado, I'm so excited to begin our first interview of the 2021 to 2022 Project Pulse Winnipeg year. We will be organizing this event in two sections, one where we will be discussing your career and role in cancer diagnosis and treatment, and the other where the questions will be focused on providing our audience with your advice and insight that may help them with their own pursuits and passions in the future. So the first question is, what do you do?
Sure, I'll start. So I'm one of the radiologists, MSK radiologists at Health Science, as I mentioned. So from a day-to-day perspective, what we do is we're involved in imaging of patients. So that involves X-ray, CT, MRI, ultrasound. And when it comes to cancer diagnosis, imaging is vital to the diagnosis as well as treatment planning for cancer. So each day, I specialize in sports medicine, but I also specialize in sarcoma. So we do a lot of sports injuries, so rotator cuff tears, meniscal tears. On the other side of things, we do a lot of imaging of sarcomas, which are basically cancers of the muscles and of the bones. So from an imaging perspective, we can first do the diagnosis so we can see if there's a lesion there, if there's a mass there, and then we try to, based on our experience, based on all the sequences that we have, we try to decide what kind of cancer is it, and then also its relationship to all the other structures in the body, and to help the surgeons, help the oncologists and radiation oncologists decide their treatment planning as well too. So imaging oftentimes is a first step, and then after that, once we've identified there's a tumor, then it goes on to the rest of the team to try to decide what to do next. We're also involved in biopsies. So when we see a lesion or a mass, we will take samples of it under CT or under ultrasound to send that off to pathology, and then they can tell us what specific type of cancer it actually is as well too. So a lot of it's from radiology. What we do is basically diagnosis and help in hopefully treatment planning as well.
Sorry, so I think one of the speakers who were supposed to be here earlier, Dr. Hebbard, so after sort of the initial diagnosis process starts with guidance of radiologists like Dr. Bhullar, we often work with our surgeons who help either with acquiring tissue to make that diagnosis, or in the case where it's a cancer that's maybe localized and hasn't spread elsewhere in the body, then the surgeons are quite critical in removing that tumor. And it's ultimately the removal of the tumor that is one of the most important steps towards curing that cancer. But it also allows us to get further information about that cancer. So how big is it? Has it involved lymph nodes? Was the surgeon able to successfully remove all of it, or is there a concern that there might be residual tissue left behind? So when there's a concern that perhaps the surgery itself isn't enough to cure that cancer, that's when people like myself get involved. So I typically give what's called systemic therapy. So these are treatments that kind of work throughout the body. And these treatments can come in three forms. They can come as chemotherapy, and I think many people hear the term chemotherapy, and sort of lots of images come before your eyes. Not only do we give chemo, but in the current era, we give treatments called targeted therapies. So the idea that based on the features of the tumor, and particularly molecular features of the tumor, we might give treatments that are specific to a target and therefore has less side effects than traditional chemotherapy. And now we're using a new type of therapy called immunotherapy, which works by helping the body's immune system recognize and identify the cancer. So for someone like myself, who's a medical oncologist, again, my role is typically, once a diagnosis has been made and we have to decide on, whether further treatment is required to cure that cancer, or if the cancer is already spread or metastasized to other parts of the body, then oncologists like myself help decide on what treatments might work best to control those cancers. So I focus entirely on the treatment of adults, and so I'll pass it on to Dr. Oberoi, who's broader than I.
Thank you, Dr. Banerji and Dr. Bhullar. So I, in my clinical practice, treat children with cancer, and also with the children, children who have blood disorders, which are non-malignant as well. Since this session is focused primarily for the patients with cancer, my role is similar to what Dr. Banerji's role is in the adult world. So as a pediatric oncologist, we obviously with the help of our surgeons and with the help of our hematopathologists and other pathologists, we are usually able to make the diagnosis. Some of the cancers among children require surgery, whereas some do not, such as leukemias and lymphomas, which are the common type of cancers we see in children. They typically do not require surgeries. And they are very sensitive to the chemotherapy drugs, which are either given by mouth or IV, or also into the spinal fluids, where we also see the solid tumors such as sarcomas, and also tumors of the kidney, and other tumors such as neuroblastomas. And those tumors usually require a very multidisciplinary approach where the surgeons play a key role, and also radiation oncologists, pathologists, and radiologists have to come together to plan that treatment for those children. So yeah, that's pretty much of my role as a clinician. But besides that, I'm also interested in clinical research, finding ways to improve the symptom control and supportive care, and improve the experiences of the children and adolescents and young adults when they go through this cancer treatment, and also once their cancer treatment is over and they head to the survivorship phase.
Obviously what I do is I'm a surgeon. In the cancer world, though, surgeons interact with cancer patients in all sorts of ways. So patients can come to us with a symptom, and surgeons are oftentimes very involved in the workup of the patient to find out if they have a cancer and what one. So a patient might be referred to me with a change in their bowels or their pooping, and I might do their colonoscopy and find out they have a colon cancer. The bulk of the work is obviously surgically removing cancer. And so in my practice, I do breast cancer. I do a variety of different abdominal cancers, such as stomach cancer and colorectal cancer, and other sort of weird cancers, sometimes sarcomas and skin cancers. So there's all sorts, cancer can happen anywhere, but those are sort of our main areas in the trunk for my type of practice. In addition to that, I have a sort of an administrative job as well. So I am the lead for cancer surgery for the province. And so that's like a paperwork kind of job where I help to direct policies and where the direction for, that the health system should be when it comes to cancer surgery.
Thank you so much. So the next question is, did you face any difficulties as you were pursuing your field, perhaps a difficult decision where you were split between your personal life and your work life? And do you wish you had known anything before you did pursue your field? So just basically, did you learn anything or did you face any challenges that you wished you would have known about before? And what advice would you have given your younger self, I guess?
I guess I'll start here. I guess the one element that I didn't realize when I perhaps got into medicine initially is how long the learning journey was going to be. I think that many of us graduate from school and think you'll be in university for 5 to 7 years, and at the end you'll have a useful degree and you'll go on and work, etc. And I'd say 15 years later, you're still training because of there's so many opportunities to acquire specialized skills. I can say sort of in my situation, I gave my entire 20s to the study of medicine and into my 30s, right? And the reality is it does occupy a lot of your time, and it doesn't leave a lot of extra time to pursue many of your other interests that you may have had before. So it requires picking and choosing priorities in your life to spend your time on.
Thank you, Dr. Banerji, and I would echo what Dr. Banerji said. It is being an oncologist is basically a lifelong commitment to learning. The field is ever changing, and it does require a lot of your time, even beyond your clinical hours at home, in the nights, early in the mornings, weekends, to just to give your best to this profession. But this being said, I never regretted that I chose this profession. This is very satisfying. Having the patients go through this journey and supporting them through their cancer journey is very rewarding. But it definitely does impact your, it's hard to maintain a good work-life balance with this profession. If you're very dedicated to your profession and you are committed to be an oncologist and don't mind compromising your personal life in some ways, then go for it, for sure.
Yeah, I would very much agree with what Dr. Banerji and Dr. Oberoi said. I think the length of time it takes is interesting. And on top of that, is once you're done, you have to keep on top of everything as well too. So one of the things that surprised me is, you think to yourself, okay, at the beginning, after high school, you do all these exams, you do all the schooling, and then you're done. Then you can just work. But actually, medicine is one of those things where you have to keep on top of it. Everything's changing all the time, and you have to keep on top of it. So you keep having to study, you keep having to read journal articles. So it doesn't stop after you're done residency and training, it continues. But that's the cool part of it as well too, is that you have to stay on top of the research, and you want to make sure you give the best care to the patients you're giving today, not 10 years ago, but today. And so things have changed, and things are constantly changing in medicine. And that's the very cool part, is that we're constantly evolving, and we're constantly coming up with new diagnoses, new treatments. But with that, with that exciting progress comes, a commitment on your part to keep on top of that as well too. Because if you don't know about it, you can't offer it to your patients. So, one thing, I guess, if I were to say to my younger self, is that don't think that it's done after residency; it continues.
I don't know if torn's the right reason. I think in order to be a surgeon, you have to really love it. So in addition to, we're sort of talking about this cancer world, as a general surgeon, I still help in the hospital to provide on-call services. So patients can present with surgical emergencies 24 hours a day. And so all of us, regardless of what we do in our regular day, participate in a rota or a schedule so that all of that stuff is uncovered. So that might mean like once or twice a week, I'm in the hospital in the evening or overnight with someone who has a hole in their bowel or an appendicitis or a bad gallbladder. And all of that comes down to, this is a time-intensive job. So it's not a 9 to 4 job. I easily, most weeks, work 60 to 80 hours a week. And you have to, and that includes sort of being on call overnight. So you have to really, really love it. So it is sort of my job. It is my hobby. It's my passion. And other than that, then it doesn't really feel like a sacrifice because I'm sort of all in for this. It does pose some challenges to do that. So I have a family. I have a daughter and a partner, a dog. So balancing some time between work and home, and also trying to shut off when you're home. So when I'm at home, I try to be mom. And when I'm at work, I'm Dr. Hebbard, and sort of learning over time how to make those differentiating those aspects of your life. I wouldn't say that's a deterrent or someone shouldn't have to be, but I think you have to have a lot of passion for both of those roles in order to do them. If it's just like, oh, I might like to be a doctor, or I might like to be a physiotherapist, or I might like to be an accountant, like you have to follow your passion.
This question kind of relates to our second portion of this interview about kind of giving our high school students and post-secondary students advice. And I know you all touched on kind of sacrificing your personal life for your work life. And I know Dr. Banerji talked about choosing your priorities. And while we're on the subject of that, do you have any advice to our high school students who might feel intimidated by the field of medicine? Because I myself know I would like to go into the field of medicine, and it seems very intimidating, but as the three of you touched on, it's very rewarding. So do you basically have any advice on how you can choose these priorities and how you can kind of maintain a good work and personal life balance?
Yeah, I can touch on that. I think that's a very important part, is medicine can consume you, especially when you're young. You know, you want to do well, you want to pass all your exams, you want to get good grades, but you know, you can study endlessly, and so it can consume your whole life. So one advice that I always give is have extracurricular activities, have something outside of school and medicine to keep your mind occupied, but also just to give you a break from all that. So for me, for example, it was swimming. I was a competitive speed swimmer. And so my main stress reliever, my thing outside of medicine was swimming. And that took up a lot of time, but I loved it. And it was exercise. It got your mind off things. It gets you into a circle outside of medicine, because you do spend a lot of time with the people in medicine around you. So, and understandably so, because you're with them during lectures, you're with them during rotations. Everyone's always talking medicine. But my advice usually is, you know, have a circle outside so you're not always talking about medicine too. And for me, that was in the pool, and the people that I swam with a team. That was my way of just dealing with all the amount of time and commitment. So my advice would be, have extracurricular activities that you enjoy, and that can take you away a little bit from that side of medicine as well.
Okay, thank you so much just for your insightful response. So next question, we're going back to kind of our first portion about the field of health sciences and cancer. So the next question is for Dr. Banerji or for Dr. Bhullar, which is, do you have any memorable cases that you have dealt with? Perhaps it was very bittersweet, or it was particularly difficult, etc.
I can start. So just to first to add on to the answer that Dr. Bhullar gave about sort of the career choice and finding balance. I think the one important thing about medicine that everyone needs to realize is that you really need to have a passion for it. It's not a great field if you don't enjoy the subject. And the reality is that many people choose medicine for different reasons. Some choose it for their own reasons. Others choose it to make others happy. But the reality is that it has to, the drive for learning and that drive for knowledge in medicine has to come from within, because if you don't have that passion for learning and the willingness to adapt to the field of medicine, it can consume you, and it can slowly be sort of knock you down over time. So you really have to be passionate about the field. In terms of memorable cases, so one of the reasons after I finished my training here in Canada, I went to the States for a few years. And the main reason I went to the States is to do some research, but to learn about new treatments that were coming, and being able to understand how those treatments work, but more importantly, how to implement technologies to diagnose patients so that we can use those treatments. And I remember within a few months of coming back to Canada, I had a fairly young patient with metastatic lung cancer who didn't respond very well to any of our usual chemotherapies. And realistically, on the trajectory she was going, she probably would have died within sort of a couple of months of a particular point in time. And basically because we'd run out of usual treatment options. And so we just happened at that time to introduce a new gene test that we could do here in the province. And just as kind of a Hail Mary, we sent the tissue off for testing, and the result came back, and we were able to put her on a new drug. And so this is someone who could barely walk 10 feet, who suddenly, within the span of 2 weeks of being on the medicine, was able to function normally again, and wound up living an extra 3 years of really excellent quality of life. So that's kind of one of those standout moments where you think things are going to go quite poorly for that patient, and you're preparing for the worst. But thanks to improvements in both in technology and in knowledge, you're able to find something new and provide new opportunities.
Okay, great. Thank you so much. I think that definitely just makes it really evident about how rewarding going into the health sciences is, because you literally do so much amazing stuff. Okay, so next question is for Dr. Bhullar, which is, what do you think is the most difficult aspect of being a radiologist?
Well, it's a difficult question. I would say probably the most difficult aspect is kind of what I touched on before, and that's keeping on top of new developments in radiology. We're because as I mentioned before, there's different modalities that we use, so X-ray, CT, ultrasound, MRI. There's PET scans, there's nuclear medicine, and things are constantly changing. Especially in MRI, there's so many sequences that we can do. And so many images that we can take to kind of put the puzzle together to figure out what a lesion is, or what a problem in the body is. And so I'd say the most difficult thing is finding the time outside of your clinical work to keep on top of all the new research, all the stuff that's going on in the academic side, and reading those journal articles, and balancing that with having a personal life too. So that's kind of I would say the most difficult part. As you can see right now, like we're just out with the dog to the park, but we had to do, there's some other things. So you have to try to, you have to make sure you're taking care of your personal life on top of that. But you want to keep on top of the academic side, the medicine side too. So that's the most difficult part, I would say.
Thank you. So while we're on the topic of kind of new technologies and new tactics, I guess, for health sciences, what progress in the future do you think, or like kind of what new technologies do you think could happen in the future? And I know that's a very, you have to really think about that question. So maybe instead of answering that, you can also think about how has the advancement of new technologies impacted your research currently, and how you think it might impact it in the future.
for in our field in radiology, it's probably artificial intelligence. I don't think it's going to replace, doctors and radiologists. I think it's going to make things more efficient in the future. To be honest, a lot of people are afraid that with artificial intelligence coming along, that maybe doctors will become obsolete and maybe all the work will be done by computers and robots. But I don't see that happening, hopefully in our lifetime. But the one thing I could see happening is that it makes our jobs more efficient and easier than rather than more difficult.
Yeah, I can also add something to this question. As Dr. Bhullar mentioned, and also Dr. Banerji initially, that this era is actually very exciting for patients with cancer, because a lot of advancement has happened from in last decade. We have many targeted agents with which we are able to target specific type of receptors, which the activation of which can cause persistent growth of cancer cells. And similarly, immunotherapy has also changed the landscape of and the outcome of many patients with cancers, and improved their overall quality of life. And so that's very, very exciting. And I think that's where this whole field is moving. Besides that, I think Dr. Banerji would talk about how we are integrating personalized medicine into oncology, or looking at each patient's tumor as separate and seeing how we can actually treat that patient with a cancer appropriately with the least toxic amount of chemotherapy and still maintaining the good survival rates. So that's something is being very exciting, which is happening in the field of oncology, and it is ever changing. You have to be on the top of it, so which is cool, as Dr. Bhullar described, but which sometimes can be difficult to keep up with. But it's definitely very, very exciting.
Yeah, so I think from my perspective, there's three major changes happening in medicine in general. So one, we've touched on technology, and technology comes in lots of different flavors, everything from artificial intelligence that Dr. Bhullar spoke about. And then we have, just ever expanding tools for molecular characterization of our tumors. So historically, we've done that from the biopsy, so actually a sample of the tissue. Now tools are being developed that we can perhaps even do it from blood, and sometimes even get answers from blood before even sampling the tissue. So there's definitely technologic advances that are happening quite rapidly. I think the other piece that's really changed, I'd say, in my career is just the access to information for our patients. So both through the internet and just through social media, our patients are very connected. I think that definitely can work as an advantage, and Dr. Oberoi does a lot of research on how patients rely on various platforms to acquire information and how they use that to advance their care. But on the flip side, you also have a lot of misinformation out there, and a lot of your time with the patient in front of you is not only spent discussing the treatments you're planning to give, but explaining why sort of these other things that they've read about on the internet don't apply in their situation. So it definitely makes the conversations more complex. And I think the other piece that's rapidly changing in medicine is what that medical team looks like. I think historically it was a very reverse pyramid type of thing where you had the doctor on top, and then you had sort of the nurses and pharmacists, and then kind of built from there. Now the team, the healthcare team, is different. It's less about a pyramid and more about kind of parallel structures. So we definitely physicians play an important role, but we've got people like nurse practitioners, social workers, physiotherapists, occupational therapists, and even people like physician assistants who didn't even exist, at least, when I was in medical school, that wasn't a career that existed. So the team is far more diverse, and it's really, the system as a whole is changing, and trying to adapt that to work around providing better care has been a big change, but a good change in many ways.
Thank you to all of you. I learned so much just from that question itself. And kind of just jumping back to the present, how has your work been?
Oh, I mean, there's so many things that are different, right? Like, so when I was in high school, it was the beginning of email. I remember just a few people had email. It was this DOS-based thing. It took forever to upload. And now my email is on my phone. And if it takes more than a fraction of a second to upload, I'm like, why is this taking so long? So many things change. When I started off in the end of your medical school is called your clerkship, where you're sort of learning how to work in the hospital. And when we were clerks, the CT scans and x-rays, they were printed out on a film, and you had to go and get them. And once a day you looked at this stack of images, and now they're on a computer screen. And not only that, it's a computer screen with this sort of funny interaction with my cell phone. I can then look at home when my resident calls me now. So I don't even have to go to the hospital to look at it. So there's so many different changes. In the cancer world, there's always these ebbs and flows. We learn about new medications. Many of them are chemotherapy, but they can be other things, which takes a patient who had no options and gives them options, maybe can cure them or keep them alive. But as a surgeon, that then opens up different surgeries that I may not have been able to perform at that patient, because now we can shrink down a tumor that we could never take out to something that we could take out. So all of the advances in medicine, they all interrelate. And so even if it's an advancement that isn't like a medication that I'm not going to prescribe, it may in the upcoming years have an impact of what types of surgeries we do. Maybe we'll do, and in some cases we'll do bigger surgeries because now we know we have something to help cure the patient. Sometimes we do smaller surgeries because the medication can do lots of that work. Surgical instruments, they change and evolve over time. Sometimes I have colleagues who get rid of tumors with specialized microwave equipment. So you can do that with like liver tumors is a common area. We have a specialized system in my group where we can give chemotherapy intraoperatively. So that's chemotherapy given by the surgeon. And so there's also, it's hard to just limit just how many things there are, but it's an exciting area to be in.
And kind of just jumping back to the present, how has your work been affected by COVID-19? Have you faced any difficulties, challenges, or has it basically remained unchanged?
I can touch on that. As we all know, children were less impacted by the COVID-19 pandemic from the medical aspects, but definitely given that children with cancer are vulnerable, immunocompromised, so they are at more risk of getting complications of COVID-19. So during last 2 years of this pandemic, our team, the goal of our team has been how to keep our children safe in the hospital while they're getting treatment in the outpatient clinics, and also how we maintain a good communications with the ever-changing rules and recommendations of COVID-19 pandemic with the different waves. It's very hard for the families, for the parents who are going through such a difficult situation with their child. Having a child with a cancer diagnosis is very can be very traumatic and difficult, and and already put a lot of distress for these parents. So imagine that only one parent is allowed in the hospital with their child during this COVID-19 pandemic. So a lot of effort has been to even advocating for our patients and their families, making sure that at the key point of their journeys, the families can come together in a safe environment still and support their children and each other. So yes, it's more of like besides dealing with the medical aspects, it's mostly has been how we deal with the social aspects of this COVID-19 and also mental health, so that our families and the children are not affected mentally too much by this pandemic. The third part was also like deciding how we send the children who are, what recommendations we should actually make for attending for school for these children. So that has been a difficult effort as well, making sure that balancing the risk of COVID at the same time, seeing that how we can support them in their development and in their academics has been a little bit challenging, but this is what we are struggling in, at least in the field of pediatric oncology.
Yeah, I mean, the pandemic has caused a lot of challenges and a lot of difficulties. In my field, in radiology, for example, we're still dealing with a lot of backlog of scans that were canceled during the pandemic. And so that affects every facet, cancer patients, affects non-cancer patients. And so we're struggling and trying to kind of deal with that backlog. So there's that side of things where the pandemic really had an effect on our healthcare system. And then personally, as a radiologist, it affects how you read scans during the height of the pandemic. So we were seeing very specific imaging characteristics and appearances of COVID, which we hadn't seen before. So for example, someone would come into hospital with shortness of breath, and if you did a chest x-ray, you saw something in the right lung, you would say, oh, it's a pneumonia, and it's usually caused by specific bacteria. But in the height of pandemic, you were seeing different patterns of lung involvement. And so what changed with us was that we started calling more COVID pneumonias, which obviously we hadn't seen before because we hadn't seen COVID before. And then we're also still dealing with the effects of people who've had COVID. They've had scans done now a couple months later after they recovered, and they still have lung changes. And we're trying to characterize, okay, what do we call these lung changes? Because again, this we haven't seen before either. So it's been pretty interesting and difficult, obviously, but interesting in that, the medicine changed actually during the pandemic. We're trying to figure out, what does COVID look like when you have COVID pneumonia? What's the effects after COVID once you've recovered? Some people still have some changes in the lungs, and what do we call that? What do we do with that? So that's been challenging as well.
Yeah, COVID has definitely, I think, impacted everyone's practice, and I don't think you can understate how much it's impacted everyone. For me, it's come in a few different ways. The first is during the early days of the pandemic, we were basically instructed to go completely virtual, and most of us who are younger, for us to go virtual, we think, okay, well, video chat with someone, that's how we go virtual. But the reality is, most of at least adult cancer patients, they're older, they may not be as tech savvy. So the idea of going virtual is basically having a phone conversation with them. And you realize very quickly how much you can tell about a person just by laying eyes on them, even without a word being uttered. And so to only hear their voice on the phone is very challenging, because you can't necessarily tell what's going on with them. And patients are scared. They don't want to say that, oh, I'm feeling unwell, or I have this symptom, because the next response from the doctor is, maybe come into the hospital, come into the clinic to get checked out. But the patients are so worried about catching COVID that they downplay a lot of what they're experiencing. And so by the time you see that patient next, they've completely crashed, because they've been downplaying or hiding a lot of their symptoms, because they're so scared, or they don't know what to do. The other aspect about cancer care and the cancer diagnosis, and Dr. Oberoi touched on this, is that the network is very important. We touched on how our own personal networks were important for us to maintain sanity and during our careers, but that's even more important for cancer patients who are going through the cancer journey. And so COVID essentially destroyed that network. People felt very isolated at home. And even when they came into hospital, they weren't allowed to have visitors and regular contact with their loved ones. And I've lost count of how many people passed without being able to have their family at their side. And so that was quite devastating to see. And then the other aspect of COVID is that it basically created a short supply of medical practitioners, and so we had a domino effect of physicians who perhaps had different roles in the healthcare system, coming in doing ICU or taking care of COVID patients in the hospital. So you had physicians trained for different tasks, performing different roles. And so it was quite a stress on the system as a whole.
Oh, wow, thank you so much to all three of you. The responses were very unexpected and surprising in a way, definitely about the social connections impact. Currently right now.
So in the cancer world, in Manitoba, most surgeries that are related to cancer have gone on schedule or close to their schedule. So my day-to-day work hasn't changed too much. As I mentioned earlier, I have an administrative or sort of like a job as well in the health system. So I've spent a lot of time in that, helping to figure out where priorities are going to be and how do we make sure that all of these cancer surgeries are getting done. So that's taken a lot of work to make sure all the patients have getting to their surgery, but it's taken a lot of extra meetings, a lot of sitting down with spreadsheets of patients and making sure that the right patient's getting into the OR at the right time. So I feel like my administrative job has been really impacted by COVID, but my day-to-day interactions with patients is pretty much the same. The only other thing is that since COVID happened, we now have a system where we can do some of our interactions with patients on the phone. Obviously not their surgeries, but some of their follow-up and stuff. So that's kind of been a new thing.
Have you found a solution to this, and have you overcome these challenges that COVID-19 has brought on you?
Yeah, I think it's hard to have a solution because things are so fluid and change. So a solution that you might have a month, one particular month might be different on another month. I will say that I personally significantly reduced the amount of virtual appointments that I would do. I personally had a number of my patients come to their appointments so that I could assess them. And I felt that that was the best way for me to provide them with the care that they deserved, which I didn't think I could do virtually.
Thank you. So now we'll be moving to our second portion of this interview, which is kind of giving our audience advice about going into the fields of health sciences. So the first question is, what advice would you give to a high school student passionate about the health sciences, but unsure about which field specifically they would like to study?
That's a great question. I think you want to stay, as a high school student, stay broad. So that usually means if you're interested in the health sciences field, whether or not that's because you want to be a physician or you want to be a nurse, physiotherapist, there's so many different areas, is to maybe go in, start off with, some general courses. I think staying broad and just expanding your mind at the beginning. If you have opportunities for work experience or shadowing or any kind of many universities or even some other programs might have the ability to highlight these different types of careers and what they look like, take those opportunities. And I just think this time of high school and university is just so rich for you to explore who you are as an individual and what you might be passionate about, what you want to learn about in life, and let that sort of take you wherever it's going to take you, because it will take you who knows where. You might be, and there's all sorts of careers that you may never have heard of. There's a thing called a radiation therapist, who's the person who actually delivers the radiation that the radiation oncologist prescribes, like really cool career that I didn't even know existed. I didn't know that much about occupational therapy. They really help patients to become independent and be able to live in their own homes. Like, what a great career that is. So we have physician assistants as well. So they have a master's degree in health sciences, and they partner with doctors so that we can kind of be two places at once, or they can sort of do some of the routine tasks and help take care of our patients. Obviously, being a physician or surgeon is a great rewarding career amongst that. I think nursing is a fantastic career. One of the things I've always found appealing about it is that it can take you in so many different directions. So nursing can end up in so many different areas. You might be in a hospital looking after patients on a ward. You could be in an operating room. You could be in home care, visiting patients in their own homes. You could be in your family doctor's office. And then there's all sorts of like administrative careers and stuff that they can be a jumping board for. So you can learn about health policy, or how to run a hospital, or how to run a department or an area. So I think has a lot of breadth to it. So also an amazing career for people.
Well, I think as long as the students are, as long as you are sure and are passionate about medicine, I would not worry about what field you want to go in, because once you go into medicine, once you go through medical school and go through your clinical rotations and interact with patients of various diseases, you will develop your interests. And so I would not worry about what specialty I want to be in. For myself as well, when I joined medical school, I did my medical school from India. It was not until the last day of my medical school I was sure that what I wanted to join as. So yes, it could change, and as long as you want to do medicine, just go for it. Yeah.
Yeah, I would agree. As a high school student going into university, I would say keep an open mind. But also, again, advice to my younger self, I was very focused that I wanted medicine. I was very interested in medicine. Nobody in my family was in medicine at the time. So it's just one of those things where it's something that I personally wanted. But, in undergrad, that's also experiences. There's experiences in undergrad. You can also get consumed again by that passion, by that want to get into med school. So you spend most of your time studying or trying to get good grades. And I'm not downplaying that. You do need good grades. You do need to do well in undergrad, but also keep an open mind, enjoy those experiences because they won't come back. As you get to the next step, as you get to med school, then you get to residency, then you get to fellowship, then you get to work, then you get to life. There's always something. Sometimes it'll fly by if you're not really careful. And so take that time in undergrad to develop, to get experiences, different types of experiences. I probably wished I'd traveled more, but some people have the means to do that, some people don't. And so just one of those things, get involved in university in activities that you enjoy. And then like Dr. Oberoi said, don't worry about what field, because everyone goes into med school with thoughts of what they're going to do, and the majority of people I know change their minds in med school once you've actually experienced it. Like, there's no way as a high school student or as a university student, what a cardiac surgeon does or what a radiologist does or what an oncologist does, because you've never spent any time in it. And so you do need to spend time in these areas to decide what fits with your lifestyle, what fits with your interests, and what you like to do. So my advice would be keep an open mind going into university, but also into med school, and just test things out and see what fits with you. Because I think, like Dr. Banerji said earlier, you don't want to hate going to work every day. You don't want to wake up every day and say, oh, I don't want to go to work again. You're going to have to do this for hopefully 20, 30 years of your life. And you want to make sure that you enjoy what you do. And if you don't, it can be painful. So just take that time to explore those options, I would say.
Yeah, the only thing I would add, I completely agree with everything that's been said, is that I think it's just important for those of you sort of just entering life right now, is the skill that will help you most in pursuing a career in the health sciences, and it doesn't have to be medicine. I think this is health sciences, and health sciences could be research, like pure research. It could be a variety of things. But I think it's important to just be inquisitive and ask genuine questions that you want to know answers to. I think having that desire for learning and enthusiasm for learning is the critical piece, because as we've all mentioned, you're going to be learning throughout your life. And I can speak from my own experience in sort of the 3 years when I finished my formal clinical training to when I took my first staff job, 50% of my field had changed. So you really need to have that inner desire to just keep learning and adapting and enjoying change, because that's what medicine is about.
Thank you. And as a follow-up question, what drew you to your own particular fields? What drew you to be an oncologist or a radiologist? Was there any specific reason why you chose that career?
I guess I can start. So I went into medicine thinking I was going to become a surgeon. Again, like I said, as you spend time in places, you just figure out what fits and what doesn't. What drew me to radiology was I like the fact that we kind of have to know a little bit about everything in the body. So from head to toe, because we're reading CT brains, we're reading chests, abdomens. I do also MSK, joints, muscles, bones. You have to know anatomy, you have to know physiology, you have to know treatments, you have to know future planning for basically everything. And I kind of like that. It provides a lot of challenges. It's a lot of, in residency, a lot of reading that you have to do, a lot that you have to learn. But I do like the fact that I can have an intelligent conversation with a neurosurgeon, and the next minute I can have an intelligent conversation with a thoracic surgeon. The next minute I can have an intelligent conversation, hopefully with Dr. Banerji or Dr. Albaroy, about cancers. And I do like that, being on top of multiple parts of the body, being kind of knowledgeable about everything in the body. That's kind of what drew me to radiology. And the second part was a lot of it's like a puzzle, putting puzzles together. So in MRI, for example, you may have 15 different sequences, and you have one lesion, and you can use the physics, you can use all those sequences to kind of put it all together and say, okay, based on these 15 sequences, based on the physics that I know, I think this lesion is this. And I think that's pretty cool, trying to put that puzzle together to come up with a diagnosis. So that's what drew me to radiology.
I can talk about myself. Well, I did not like puzzles very much growing up, so no wonder I did not end up being a radiologist. So I truly admire radiologists. It's a lot of, it's a definitely like, we rely a lot on imaging. So thank you, Dr. Bhullar, for being a radiologist. Well, I chose pediatrics because I loved working with children during my med school. So that was one of the reasons I chose pediatrics as a specialty. And while I was doing my pediatrics during pediatric oncology rotations, it was great to see how you can develop a longitudinal relationship with a patient. Like most of the treatment, most of the treatments for childhood cancer last for months or years, and we also follow them once their treatments are over. And during that period, you develop that therapeutic bonding with your patient, their families. You see them growing through this, growing out of this cancer and going back to their life, and again being a long-term survivor. And looking at their resiliency is also so important, how resilient those families are. And the other thing which also made me interested about pediatric oncology was ever-changing field. There is always something new which is happening. There's a lot to learn and a lot to explore and a lot to research about. A child with a cancer can have all those issues which a child without cancer can have. So you are never out of touch with your general pediatrics as well. So those were the few things which made me attracted to this field, and I'm very happy and enjoy every day of being a pediatric oncologist.
Yeah, I can say that when I I at never point really had a good idea of what I wanted to do. I'd say when I got into med school, if I was leaning towards anything, I was leaning towards being a pediatric ophthalmologist. And so why was I leaning towards being a pediatric ophthalmologist? Well, I had a major eye injury when I was younger. And I love my pediatric ophthalmologist. I just thought he was like the most amazing person, just his approach to things, the way he would comfort you in very scary situations. And then in undergrad, I had the fortune of working in a laboratory where we looked at cell biology. We were looking at cell biology of the heart. It had nothing to do with cancer. It was just understanding how abnormalities in the cell led to cardiac issues. And as I got into residency, internal medicine really got me interested because general medicine is probably, after radiology, is probably one of the most diverse fields you can have in medicine. So it allows you kind of to defer your choice of what you want to be because you're just an expert in everything for a while. And it was during internal medicine that I was able to sort of look around and say, okay, well, what fields, what subspecialties perhaps combine my interest in cell biology with my interest in sort of medicine in general. And for me, oncology was really that point where the two merged. And oncology was also one of those areas that you could see was just going to take off. Things were going to start changing quite rapidly. And it has. As I said earlier, the majority of what I learned in my residency, other than the very basics, has all changed. When I teach the residents every year, I change 50% of my lecture every year because that's how much has changed in just that period of time. I think in many ways that can be daunting for the next generation because it's a lot of information to learn. But that's where I think the system that we work in and the team that we work with is very important, because one individual can't know everything unless you're a radiologist, in which case they do know everything. But you really are dependent on sort of everyone around you having bits of information and working together. And that includes the patient, because patients themselves are very knowledgeable as well, and they're living it firsthand.
I used to joke that, and you guys probably don't even know the story, but that I used to watch the show ER too much, and that's how I decided to be a doctor. But I think as I got into medical school and I found that I loved surgery because it had certain things. It's got high pace to it, which I like. I'm a pretty energetic person. It had a nice combination of immediate, like you have, this patient's bowel is ruptured, you have to fix it now, and it's a life-saving thing. But on the flip side, then I go to my clinic and I follow a cancer patient that I might have known for 4 or 5 years and have a relationship with them. So it hits on so many different areas that's what I really love about it. It's one of the challenges of it because you have to stay current on so many different areas, and you have to stay energetic, and you have to stay to keep up with a demanding career, but it has so much rewards on the backside of it too.
So our next question is, out of GI malignancy, breast cancer, and melanoma, which would you say is the most complex or difficult to deal with?
They all have different so we commonly say that breast cancer is probably the most intellectual area of surgery, because it's a lot. The surgery itself oftentimes isn't that complex, but there's a big interplay between the surgery and the chemotherapy, the other medications, and the radiation. So you need to know a lot about what the other types of specialists need to do, and there's a lot of interaction. So there's a lot of thought, and there's a lot of knowledge about that cancer. So how we apply that on, I should operate on this patient, or I shouldn't operate on the other one, or I should take out all of their lymph nodes or some. So there's a lot of headspace into making the plan for the patient, but the surgeries are straightforward. In GI cancers, oftentimes they are physically much harder and much technically more challenging surgeries to do. But the background stuff, the planning, I find, is somewhat easier, but it is sort of changing. Its landscape is changing as well as different advancements come in. But the surgery is more complicated, and the potential for the patient, like there's a lot more care of the patient. So a breast cancer surgery is oftentimes day surgery. So we do it. It takes an hour or two. They go home. A colorectal cancer patient is in hospital for a number of days. And sometimes we even operate on metastatic cancers in the belly, and those patients can stay a long time as they're recovering, and you're monitoring for different complications and dealing with them when they come. So the day-to-day work of that is heavier.
I see. And you kind of talked about the planning process. How long does that usually take to kind of plan everything out and kind of contact other specialists?
It's variable. It depends on, for many patients, the first time you've seen them, once you've reviewed everything, then you might be ready for a plan, just with all the knowledge that you've gathered up. Some patients, though, particularly if they're seeing a surgeon, they may not have all of their tests done. So let's say they've come and they've had a scope, but they haven't had a CT scan, or they had a CT scan and you need to order an MRI or a PET scan due to some abnormality on that. So that might take a number of weeks, and then bringing the patient back. Frequently in cancer, as it starts to get complex, we meet as a group, all the different specialists, on a regular basis. It's oftentimes weekly or every 2 weeks, to review all of the complex plans. And so sometimes that takes a couple of weeks to get the patient case on a list, and where we all meet at a regular meeting. It's called a case conference or a tumor board. So it can ebb and flow a little bit. And sometimes we make an initial plan, and then we go, okay, we're going to do chemo for 3 months, and then we're going to do a new CT scan and see if that's shrunk. If so, how much has it shrunk? And then revisit, well, what surgery are we going to do? So some of those are we have a plan A, and then sort of part B happens at a later time. Other patients, they come in they have a straightforward breast cancer. I see them, I talk to them, an hour later, we have the plan completely all ready to go. So a lot of variability.
Okay, thank you. I see. So our next question is, when we usually think about surgeons, we commonly think about using like scalpels. Are there any other not as known or up and coming techniques that you would like to introduce to our audience?
Yeah, I mean, yes, we always think of the surgeon, the scalpel, and most surgery, however, is done with what we call a cautery device. So an electrical device, which is like an electrical scalpel. That just controls bleeding better. And so we use a cautery machine to do most of our surgeries. There are certain areas, patients oftentimes ask if they have their surgery done with a laser, and there's limited uses for lasers in different specialty areas. I just myself learned a little bit about how a certain type of prostate cancer surgery, or prostate surgery, not necessarily cancer surgery, now uses a green light laser, a specialized laser. But those are specialty areas, not like everyone having surgery for everything. As time goes on, in general surgery, we do more and more surgery laparoscopically, and that means putting in a telescope and then long instruments, so they only get little keyholes to put in rather than a big cut up and down in their belly. And that technology advances all the time. There's even some areas where there's robotic surgery, which is sort of a next step of laparoscopic surgery, where a robotic system is helping to manipulate that camera and your instruments so it's even more precise.
Thank you. And this is probably the last question that we have time for today. And it is, what is one lesson that you've learned or one mistake that you have made that has greatly shaped who you are as a person and professional?
It's a tough question. I guess I can try to start. One thing I've learned is, I guess, perseverance. As I think we've all touched on, healthcare, medicine specifically, but any healthcare field, pharmacy, optometry, any healthcare field, but I can only speak to medicine because that's the one I have experience in, is that you need perseverance. You need to, there's a lot of times when the going gets tough. You know, the hours are long. There's a lot to get through, a lot of studying, a lot of on-call, evening, weekend stuff that we're still doing. So, you know, I personally, you know, in residency, it's, you know, there's a lot of on-call, a lot of evenings and weekends. And you think that, okay, when you're done, you're a staff person, that, you know, at least it's better. But the way medicine is going, there's a lot of on-call stuff, a lot of weekends, a lot of evenings, a lot of daytime pressures. So one of the things that I learned that was a challenge is, you know, is perseverance, is coming up and knowing that, you know, you have to stick to it. You have to, especially when things get stressful, you just got to have coping mechanisms. You got to have a way of dealing with all the stress that medicine comes with. There's a lot of rewards. There's a lot of, you know, internal rewards. As you know, you have a stable job. You know, you can provide for your family, but on top of that, then, you know, the rewards with the patients, the fact that you're actually making a difference. It amazes me sometimes, to be honest, like when I'm doing biopsies, there's a person, you know, who comes to get this biopsy done. They've only met me once or twice maybe, and they're allowing me to take a sample of their tumor or something like that. And that's so unique to medicine. I mean, can you imagine, you know, any other place where a perfect stranger comes and says, you know, please, you know, you have complete access and you can take a sample from my body. That to me is amazing. And that comes up with a lot of responsibility. Dr. Oberoi and Dr. Banerji, you know, they have obviously much deeper and longer relationship with the patients. The one thing in radiology is that we get limited patient contact. The contact that I get is usually with the, you know, the biopsies or the joint injections. And that's the part I enjoy a lot, to be honest. You know, is that patient contact. But it does amaze me the amount of trust that patients have with their doctors, with their healthcare system. And that's a very big privilege that we have, and something that we have to honor, and that I never forget. The fact that, like, you know, again, someone is coming here, they barely know you, yet they're you know, they're putting their life in your hands, and that to me is amazing.
I would echo what Dr. Bhullar said. It's becoming more resilient, and also perseverance is something I have learned as well. But something I have learned over a period of my career is how to incorporate patients' view, their perspective into their care, and how to provide a holistic care to our patients. This is something which I did not learn very early in my career, but over the years, I have learned how to value patients' perspectives into their medical care.
Yeah, so completely agree. Perseverance has been very important. And I think I mentioned before, just being able to embrace change, and in many cases, have the drive have the ability in yourself to drive change. I think one of the challenges with medical systems is that medical systems don't want to change very quickly. Particularly in public healthcare systems like we have here in Canada. You know, systems work best when they're stable. But the reality is that healthcare doesn't give you a stable system. It's one that has to constantly improve and adapt. And as physicians, we find ourselves as constantly fighting that battle of getting the system to change and improve with the times. And so that's where the perseverance really comes in. But I think you need to take pride and excitement in leading that battle for change.
I think we learn from everything that we do. I think you know, anytime you communicate with a patient and they didn't hear what you're saying, it tells you how to do it better next time. And at the same time, one of the hardest things we have to do is tell people bad news, like, you know, your cancer has come back, or there are no other treatments for this cancer. And that's a really hard thing to do. But when a patient or their family report later on that they felt really supported through that, or them hearing it from you because you knew them for many years as opposed to a stranger was a help, there's a certain reward in that too. So I think I learned from my patients how to constantly be better by listening to them for when I've done a good job communicating, when I haven't done a good job communicating. So I think that's probably where I gain the most at this point.
Thank you for just those really insightful lessons about perseverance, etc. And as I said before, that is all the questions we have time for today, unfortunately. And on behalf of Project Pulse Winnipeg, thank you so much for sharing your valuable experiences and perspectives and answering our questions with such insightful and thoughtful answers.